Hello, everyone. Thank you for joining us today for DoctorCare's webinar on practice billing for dummies. We are excited to be here with you today for the next 30 minutes or so to compare and contrast how our new Executive RA dashboard from our new practice care program stacks up to the RA summary that you receive from the Ministry of Health. Let me start by introducing myself. I'm Maral Sanassian, the Senior Regional Director of Healthcare Consulting here at DoctorCare. As many of you know, at DoctorCare, we help primary care physicians enhance patient care, run better businesses, and improve their own quality of life. To date, we've helped over 1,200 family doctors improve the lives of more than 1.5 million patients through our suite of programs and services. Before we do get started with the content, there are a few logistics I would like to review with you. We are using the GoToWebinar platform for this webinar. All participants have been signed on in the listen-only mode. But throughout the webinar, you are welcome to submit questions through the chat console. If you have logged into your computer to see the presentation on the slide deck, you're going to notice the GoToWebinar console on the top right of your webinar screen. Through the chat feature, please feel free to type and submit your questions. We'll take questions at the end of the webinar. Your questions and your identity will only be seen by me. I'll read out your questions, but we'll keep all identities confidential. Also, this webinar is being recorded and will be provided to all attendees for review and sharing. Let's get started. Today, you are going to visually get a glimpse into how else you can obtain the same data you are used to receiving from the ministry in your monthly RA summary, but in a format that takes a lot less time to access, to read, and to get actionable insights from that can be applied to your practice right away. This is critical information and financials that will ultimately help you enhance your practice's efficiency, revenue, and patient care. First, a quick background on practice care. At DoctorCare, we recently launched our new practice care program, our next generation program for primary care practice management. This replaces our former service, PhoCare. Our new practice care program now features more analytics and new actionable insights to help you improve on billing optimization, on roster management, bonus optimization, and preventive care support. Practice care goes beyond just handing you a report on a quarterly or monthly basis. Doctors are now part of an interactive, intuitive, and responsive program where DoctorCare is now helping you manage all aspects of your practice. We invite you to visit our website for more information about practice care at www.doctorcare.ca/PC. Let's dive in. Let's talk about the first topic in our new Practice Billing Series for Dummies webinar program, how to read your MOH RA summary versus our new Practice Care Executive RA dashboard. You're all very familiar, most likely painfully so, with this view. This is the Ministry RA that you receive and review today every month. Your RA summary, the page in the middle of your screen, can be found in your RA after the seemingly endless list of claims. And this is where the real valuable information can be found. So what's the problem with the RA and the RA summary? As you can see, it's not easy to quickly scan and review. You need to scroll through pages and pages of plain text back and forth to find critical data points. Your RA could be well over 50 pages long. The majority of the data only contains your billings from the previous month. That looks like a bunch of code and is unreadable. Most importantly, the RA does not provide actionable insights. That's why most doctors end up never reading it. Over the last couple of years, we've tried to help doctors by hosting RA summary education webinars, essentially how-to guides. By the way, if you are interested in learning how to more easily read your RA summary, you can head over to our website to our recorded webinars page. At the bottom of the webpage, you can register and watch our recorded webinars on RA Summary for both FIGs and FOs. We've also tried from our end to help our doctor clients as much as possible with deciphering the RA Summary. Our field team does one-on-ones with doctors, helping them interpret their own RA Summary, and this has helped. It is quite a popular request. But at DoctorCare, we still found that the RA Summary wasn't being used as effectively by doctors as it could be. And this is because it is such a difficult document to read and to decipher and to navigate. It's time-consuming to step through it. Whereas in our new Practice Care Program report, we have separate and specific report modules that dive further into 9 key areas to help you more comprehensively address the key areas of your FO practice and your FO billing. These modules contain more analytics and new actionable insights with new recommendations from DoctorCare. Now let's discuss the Practice Care Program report module that is the star of this webinar, the new Executive RA Dashboard. The Executive RA Dashboard is something that is completely new to our industry and primary care practice management. It's a module in our Practice Care Program report, 2 pages of critical financial information for your practice. Why did we invest resources in this? The Executive RA Dashboard was created to help doctors clearly understand the ministry RA that they receive every month, and how to understand their monthly income and what it is broken down into. We like to think of it as a dummy guide for the remittance advice. On the screen, you are seeing the section of the Practice Care Report module that contains the Executive RA Dashboard. It's actually just 2 pages. And within these easy-to-read 2 pages, it contains key practice information from many different parts of your RA summary. And the information is presented in dollar figures, tables, etc., not just in plain text. Let's dive right in and step through how the dashboard contrasts with the ministry RA. We'll start with contrasting total income for the month. On the right is where this piece of information is on your ministry RA, circled in red. It's the first line on the first page of your ministry RA. On the left is where we have it in our Practice Care Report, within the Executive RA Dashboard module, circled in blue. Here's a high-level overview of the dashboard. Below the total income, we report on key revenue information for your practice by critical sections such as capitation, roster management, out-of-basket billings, fee-for-service, access bonus, special premiums, preventive care bonuses, and other payments and adjustments. And we report these sections not just for the previous month, like in the ministry RA, but for the current month, the current fiscal, and previous fiscal years. So you really can see any trends in your practice and your income. Then on the following table on the next page, you get an additional revenue breakdown over your previous 5 months. This includes how much you made in each month and a breakdown of income streams for each month. Let's talk next about capitation and rostering. Every FO physician needs to be on top of their roster. Capitation for a FO doctor is a significant contributor to your total income, typically about 70 to 80%. That being said, we notice that rosters tend to fluctuate. Patients come off the roster due to the ministry, you remove some patients, etc. It's important to review and to see the trend in your roster and capitation to make sure your capitation doesn't decline and therefore your total income declines. What we see often here at DoctorCare is that patients can fall off the doctor's roster without you even realizing it. That's why it is really important to keep monitoring your roster. As you can see on your ministry RA, you'll need to dig up these critical pieces of information. You'll find both data points in the RA summary section, and in this particular sample RA, capitation is found at the bottom of page 39, while rostering data on enrolled patients is way down on page 46. This is why in our Practice Care Program report, we have capitation and roster management sections within the Executive RA dashboard to ensure that you can easily view these critical data points near the top of the dashboard. With this view, you can understand if there have been fluctuations over these time periods with your capitation, and you can get a clear idea of your roster. We also provide a revenue breakdown for this critical information monthly for the previous 5 months. Remember, your ministry RA will only provide data for the previous month. Remember, our Practice Care Program report also has a separate and more detailed module on roster management to ensure you have all the actionable insights required to make sure your roster is up to date and managed appropriately. Next, let's talk a little bit about out of basket. We all know this is a really important part of the FO, as it is a revenue opportunity on top of your roster to get full value for the services you provide to your patients. In the Ministry RA, this is where you can find it. See the red highlights on your screen. In our Executive RA dashboard, it's reported here so that you can track and increase your out of basket revenue. We don't just provide the data for the month, but you can see the dashboard also reports the previous fiscal and current fiscal figures for easy reference. Again, we also provide a revenue breakdown for this critical information monthly and for the previous 5 months. Again, this is why our Practice Care Program report has a separate and more detailed module on the out-of-basket analysis, so that you can get all the actionable insights you require to track and to increase out-of-basket revenue. Let's move on to the other fee-for-service, which is mostly the in-basket codes you build on non-rostered patients. It's found here in your Ministry RA summary. You can see the red circled area. On our Executive RA dashboard, you can track your other fee-for-service to make sure you are hovering below the fee-for-service cap that you are allotted. Once again, we also provide a revenue breakdown for this critical information monthly and for the previous 5 months. This is why our Practice Care Program report has a separate and more detailed module to help you address other fee-for-service fully. The report contains a separate high needs module, which monitors your fee-for-service cap and provides actionable insights to capture more fee-for-service revenue. We also report on other income streams that you may not know about or have visibility into, such as WSIB and network colleagues. On a Ministry RA, on this particular sample report, it's near the end, if you take a look at the red highlight. It's quite buried deep in the RA. Contrast this with our Executive RA dashboard, where the same information is very easy to access and read. And again, we provide more than just the previous month figure. We provide the current and previous fiscal year data, as well as report on the previous 5 months by monthly figures. With regards to access bonus, this is where you'll find it in your RA summary. In the Executive RA dashboard, you can see the same information about your access bonus, but even better, you can see your progress over a broader time period. With our dashboard, you can also compare this to your overall financial situation. Again, this is the reason why we have a separate and more detailed module that reports extensively on your outside use, so that you can really maximize your access bonus. For special premiums, here's where you can find it on your RA summary, on page 47 of the sample report. But on the Executive RA dashboard, you can see the trend of how much revenue you are generating for this and which month you would receive the bonus in. Again, this is why we have a separate and more detailed module that reports extensively on special premiums and bonuses in your practice. For preventive care, instead of trying to decode this on your RA summary, our Executive RA dashboard shows you how you are maximizing on it. And we have another module in our practice care report that provides extensive details on preventive care, as shown here on your screen. With regards to the other payments and adjustments, You'll find it here in your RA summary. See the circled areas. And here on another page, even further in. On our Executive RA dashboard, you can see the other payments all in one line. Most of the other payments are the ministry clawback. You can easily see the deductions you are losing every month because of it. And on the following table on the next page of the dashboard, you get additional deduction breakdowns for over a longer period of time, your previous 5 months. In summary, getting critical practice information and financials from a ministry RA means flipping through and diving deep on multiple pages of a report that could be more than 50 pages long. Contrast this to our Executive RA dashboard in our new Practice Care Program report. It's 2 simple pages, conveniently laid out in table format for easy reading. And it contains more than just the previous month's data. We even go back to the previous 5 months and previous fiscal periods to give you more insight into your practice's health. I hope this Practice Billing Series for Dummies webinar has been helpful in explaining the differences between your ministry RA and our Executive RA dashboard in DoctorCare's new Practice Care Program report. This ends the education section of the webinar. Let's take some questions from attendees. If you have logged into your computer to see the presentation on slide deck, you will notice a console on the top right of your webinar screen. There's a chat feature there. Please feel welcome to type and submit your questions. Your questions and your identity will only be seen by me. I'll read out your questions, but we'll keep all identities confidential. While I give you some time to submit your questions, I would like to extend this special offer to all of you, our webinar guests. To all doctors who have watched this webinar and subscribed to Practice Care by February 28, 2019, DoctorCare will give you 2 free months of the program. If you are interested, type your request through the chat or email us at info@doctorcare.ca. Okay, let's answer some of your questions that have been coming in. Question 1. If I use DoctorCare, is there any need to look at any of my monthly reports? At DoctorCare, we always recommend that you stay on top of your practice, and so we do recommend reviewing those monthly reports. However, what we have found is that most of our clients end up exclusively using our Practice Care reports because of the ease of use and because of how digestible they are. So they do naturally shift to using them more naturally. Let's take a look at our next question. This one's on rejections and errors. How can I fix billing rejections? Errors are really difficult to find amongst your standard reports as the information is mostly outside of the RA and across multiple files. You have to go through each individual file to find those errors. So at DoctorCare, we do have a new report module in our Practice Care program called the Rejected Billing Outstanding Error Analysis. The reason we invested in this was because it became a really popular request from our physician clients. We frequently hear from doctors, I don't know how to fix them, and I don't know what they are. We clearly outline this information in our Practice Care report, and it is in an easy, readable format, and it tells you exactly what you need to do with your errors and your rejections. Next question that we've got here. Where do I find special premiums, and how do I know if I've gotten paid for them, and when? In the RA, the information is buried. You do have to go to each monthly RA to find out when that premium got paid. And when you do find it, it just says special premium. You don't know which one you got paid for. Therefore, in our Practice Care report within the Executive RA dashboard, you can find this information, and we also tell you exactly in which month you've received it. That was another request we were constantly getting from physicians. A common storyline was, oh, I got $5,000, really? When? And we can point out which month you got it in, and that has been very helpful. Unfortunately, we have run out of time for questions, so if we haven't addressed your question, we'll contact you directly with an answer. On behalf of the DoctorCare team, thank you for joining us today for this webinar. If you have any questions or have feedback on this webinar, please feel welcome to contact me at any time. My email and my phone contact are listed on this slide. Have a wonderful evening.